U.S. Drug Enforcement Administration is warning Americans of brightly colored pills that look like candy and can provide a deadly dose of fentanyl. Pepper Baker joins us now in studio with the urgent push to raise awareness. Pepper?
Mike, that's right. Unfortunately, making addictive substances look like candy isn't anything new, with fentanyl being a leading cause of the rising overdoses in our country and in the St. Louis region. This is alarming. Everyone needs to be aware of the new ways drug traffickers are trying to target you.
I don't know how I could live with myself if I lost my son to a drug overdose, especially with what I do for a living. It's very scary.
18 years with the Drug Enforcement Administration, St. Louis Regional Assistant Special Agent in Charge Colin Dickey takes on a new task with tracking rainbow fentanyl.
The criminal organizations that we investigate, including the new generation Jalisco cartel and the Sinaloa cartel in Mexico, are mass producing and adding color to these substances for distribution in the United States to target children in the United States and young adults.
The National DEA issued a warning of an emerging trend of brightly colorful fentanyl and fentanyl pills in 18 states. Dickey says they've had about 5 seizures involving multiple colorful kilos in St. Louis since August.
We've seen instances in the St. Louis metro region area of purple and pink fentanyl powder. To my knowledge, no pills at this current time.
Jenny Armbruster educates young people about substance abuse through the local nonprofit called Prevent Ed.
When we think about substance use and we think about, how young people might be attracted to certain substances, this is not really anything new.
Anything to make a dollar, that is their bottom line. They don't care about the safety of the American public. All they care about is making money for their criminal enterprise.
Prevent Ed offers talking kits for parents to discuss the dangers of drugs with their children.
We always encourage that these conversations are early and often, and that we use these teachable moments to ask kids what's going on? What do they know? What do they have questions about?
With rainbow fentanyl trending upward, better to have those talks sooner rather than later.
We have seen it in the area, and we anticipate that it's going to increase in the area as well.
Dickey says drug overdoses and poisonings are the leading cause of death in Americans ages 18 to 45. The Centers for Disease Control reported more than 107,000 Americans died of drug overdoses last year, with the majority tracing back to synthetic opioids like fentanyl.